It's my pleasure to introduce Dr. Brian Skian, Director of Child and Adolescent Fellowship Training and Director of College Mental Health, who will introduce today's speaker.
Thank you, Dr. Rothschild. It is my pleasure to introduce one of our fellows and the first of our fellows this year presenting at Grand Rounds, Dr. Emily Hochstetler. Dr. Hochstetler completed her undergrad at John Brown University and went on to medical school at Creighton, where she also completed her general psychiatry training. We were fortunate enough to be able to recruit her as a fellow, and she will be finishing her fellowship this year. She is serving as one of our academic chief residents, or chief fellow in our child and adolescent program, and has been published most recently with the Worcester Refugee Project that she's been writing up, and also done a lot of scholarly work on CASI 2, and has presented this topic actually internationally at the IACAPAP conference in Dubai last year. So we are very much looking forward to hearing her talk on social media and mental health in children and adolescents. Dr. Hochstetler.
Everyone, it is good to see everyone here. Let me figure out how this works. Here we go. I know this is right before a holiday, so I'm grateful to you all for being here. No? Oh. I did, I thought. Is that, oh, needs to be higher. Hold on. Is that better? Yeah, okay. We will. This one. And I will just stand near the podium. So is saying it's good to see you all. I know it's right before a holiday, so I appreciate you all being here and on Zoom. So the topic I chose to present on today is social media and mental health in the child and adolescent population, or as I more fondly call it, hashtag social media, hashtag mental health. So the reason I chose to present on this, well, there's a few different reasons. One of them is the Surgeon General's report came out earlier this year, talking about social media and mental health. So it's a very timely topic. And then also, honestly, I just get asked about it a lot, and not by kids. Like, I think never by kids. It's usually by parents or sometimes, honestly, just adults in the community who are just interested. It's kind of a phenomenon and people are very curious about it. Hold on. Go. Okay. So I have no disclosures, unfortunately. So general overview of this presentation will be an introduction to / history of social media, a little bit about neuroscience of social media use. We'll talk about what PIMU, problematic interactive media use, is, and talk about digital access versus digital literacy, talk about resources that we can talk about with patients, and then talk a little bit about how to start a conversation with patients and parents. And I don't want to get too controversial, but I may also end up doing just a little bit of in defense of social media, not too much, just a little, because one of the most common things I hear when I'm talking about social media with patients is the implication that it is an entirely new thing. The technology behind social media has new aspects, absolutely, and we will talk about those in a little while. But the human behavior that drives social media is, well, very, very old. I would say as old as humanity. If we define social media to be the use of any kind of media to be social, that is as old as cave drawings. So the psychological tendencies behind social media are more or less the history of humanity. Bear with me. So throughout recorded history, we have constantly sought new ways and more ways to connect with each other. We're built to communicate. We're social creatures, and we are constantly reaching out. As an aside, most, not, if not all, types of psychotherapy rely very heavily on that tendency. So before we had written language even, we had words and we told stories. And if when I say stories, it rings a bell, because that's something that you see frequently on Facebook and Instagram, you would be correct. So we would pass stories down generations and stories about our history and who we are, because the stories we tell ourselves and each other about ourselves create our identity, both individual and group. Beyond something we like to do, it's also something we're frequently asked to do. I can guarantee that everyone in this room or on Zoom has at some point had to write a version of a personal statement, and probably many. And that is because it is not enough for someone to have your resume, a list of the things you've done. They want a story of who you are. So there was the oral tradition, right? Then we have the written word. And we have now accomplished the ability to make our words last and send our words long distances and share them with even more people. And I cannot stress this enough. Even then, the desire was, how do I increase my presence? So of note, let's take a small look at an example of what we chose to communicate when we did develop the written word. This is a stone tablet from ancient Greece, roughly 41 CE. I don't know if anyone speaks ancient Greek, but if you want to take a crack at what's written on it, feel free. It's, a time when one of the main forms of communication was quite literally carving something into stone. So probably this is something very, very important, right? Now, this is a yearbook. It's a list of graduates who had finished the equivalent of graduate school. Do you think that this tablet changed the lives of anyone around them? No, but they still thought it was so important that more people knew, that they literally carved it into stone, and points to them because I am talking about it today, so it worked. So history of social media continued. Jumping way ahead, we have the written word, we have telegraph in 1792, absolutely revolutionary at the time, development of radio and telephone in the 1800s, both of which I would argue were far more frequently used for entertainment and social connection than they were for anything life-threatening. As an aside, when I was thinking about some of the bullying that can take place on social media as we know it, I had looked up, because I remembered from some of my history courses, some of the attack campaign ads from the 1800s. To use as examples of historical insulting bullying through media. But honestly, they were a little too offensive for me to feel comfortable using. So if you'd like to look them up, feel free, but just be warned. As another just sort of personal example of how technology may advance, but the humans using it are exactly the same. So regarding the telephone, do any of you know the story of the invention of the telephone? So when I was growing up, my sister and my parents would poke fun at us because we would text each other. Sometimes if we were just like in different rooms in the same house, and they were like, why can't you just, get up and talk to each other? And the story of the invention of the telephone is that in 1876, the first call was placed from Alexander Graham Bell to his assistant, Thomas Watson, who was in the next room. And do you know what he said? The first words ever transmitted. He could have picked anything, like a poignant quote, a random assortment of syllables to be sure that things translate correctly. No, he said, Mr. Watson, come here, I want to see you. Do with that what you will. So you could say, all right, Emily, I see what you're getting at, right? The basic drive for connection and communication underlies all advancement so far in the ways to do this, leading to the technology that we see today. And I would say, absolutely, yes, you have been listening. But is it really like the social media of today? Okay, let's talk about the society pages. For anyone unfamiliar with the society pages, these were sections of the newspapers devoted entirely to talking about social events. Versions of them absolutely still exist today, but these clippings are from the 1920s. You can't read it very well, but if you zoom in, because I did, and it says, so-and-so had a dinner party, and these people had been invited. You weren't invited. But they wanted you to know that it happened. So if you're going to tell me that they wouldn't have posted a picture of the food that was served if they could have, they absolutely would have. We've always felt the need to connect and to update each other, even on seemingly mundane things. And yes, even one-up each other. So in summary, busy slide. Underpinnings of social media stretch from before the written word, slowly progressing until we hit a boom in the 1940s to the 80s. Technological explosion, development of the computer and the internet, as well as the first computer-based social media sites. So from here on, then, social media will refer to various internet-based semi-public and public sites and services and related tools that provide spaces for user profiles and for user-generated content, socializing and sharing. Of note, 85 was the first network for information exchange. 86 was the first chat room. And then in 1997, you have the first true social multimedia site where you could upload pictures and interact with others. And that brings us to social media as we know it. The first foray into social media that I would say would be truly familiar to us today was the creation of MySpace in 2003. Did anyone here have a MySpace? Love it. Love it, guys. So at this point, I would like to reiterate that though the technology is new, human nature is not. So both for better and for worse, which is where we start talking about some of the potential negatives. So with the advent of a type of technology where you can quickly and privately interact with people without actually seeing them, comes the people who will attempt to exploit that, which led to MySpace, in collaboration with Sentinel Tech Holding Corp., developed technology to identify and block sexual predators from online communities. They then went on to donate that database that they created to the National Center for Missing and Exploited Children, and also backed legislation to require sex offenders to register their email and IM addresses with the National Sex Offender Registry. Now, the articles I read about this were from 2006, 2007. So even within the first few years of social media coming online, they were already starting to see some of the potential negatives and were working to address them. Okay, so then comes Facebook in 2004, which became more widely available in 2006 and quickly overcame MySpace, followed by so many others. I listed some of the ones that have stuck around. So Instagram in 2010 and TikTok in 2016, but there were countless others in between that just didn't have the staying power. Vine, Zanga. I really liked Vine actually, but didn't stick around. Of interest also would be including types of social media that are not typically included in lists like these, such as online gaming platforms, which have also grown exponentially in recent years. So we'll be talking a lot about potential positives and potential negatives of social media. But before we do that, I want to take a look at this slide. The number of social media users worldwide has swelled to a record 4.9 billion people globally. What's more, that number is expected to jump to approximately 5.85 billion by 2027. And those aren't users tied to a single platform either. The average user now spreads their digital footprint across a staggering 6 to 7 platforms every month. The US Surgeon General report from earlier this year reports that social media use by youth is nearly universal, with more than a third saying they use social media almost constantly, and up to 95% of ages 13 through 17 using social media. Although age 13 is commonly the required minimum age used by social media platforms in the US, nearly 40% of children ages 8 to 12 use social media as well. So regardless of whether potential negatives outweigh positives or vice versa, the solution will never be to get rid of social media. This is an almost $50 billion industry. Pandora's box at that point has been opened and there is no closing it. So our job then is to figure out how to manipulate usage so that positives at least equal negatives, if not outweigh them. And that can look like curbing usage, redirecting usage, but it will rarely ever look like eliminating usage. So just a few more statistics about social media use. I think the takeaway here being that there are gender and socioeconomic differences when it comes to social media use. And this is especially important just to remember and keep in mind when later we talk about recommendations for social media use, to keep in mind the socioeconomic challenges that may come along with enacting those recommendations. Okay. Oh, that didn't go well. Okay. So just talking a little bit about how social media is currently being used in research because of its wide breadth of use, right? 97% of teens, almost, well, over 5 billion people in the next few years. It's a veritable wealth of possibility when it comes to research, alongside the corresponding concerns about ethical use of that data. So currently, researchers are using behavioral and linguistic cues to predict the presence of mood and psychotic disorders. And they have done so successfully with major depression, suicidality, eating disorders, and schizophrenia, among others, with accuracy around 80 to 90%. However, There's currently no standardized process for evaluating the validity of that research. There are different approaches in definitions, so there are some issues with construct validity, but it's a very intriguing possible future. So this data can be used to supplement clinical care, assess developing conditions, identify risky behaviors, provide timely interventions, or reach populations difficult to access through traditional clinical approaches. However, as we'll see over and over again, the flip side of that is that this data can also be used for monetary gain with no concern for ethical considerations. For example, in 2017, it was leaked that Facebook was collecting data and giving this to marketing groups to more effectively target advertising dollars. There were significant concerns that this is a way to manipulate the emotions of vulnerable users with no repercussions. So, I have to admit, I was more than a little nervous when I was preparing this portion because I know how many people in the room and listening on Zoom we have that are experts in brain development. So if I say anything controversial, I am counting on you all to chime in with corrections. Thank you. So just starting with some very basic things, because then we will talk about how the child and adolescent brain is a little bit different. These images highlight a few of the brain areas I want us to keep in mind when we're talking about susceptibility to social media influences. So these are the limbic system and the prefrontal cortex, which working together then are responsible for, our reward system. So then there's also gray matter and white matter. Gray matter being approximately 40% of the brain, fully develops once a person reaches their 20s. White matter, the other 60%, and develops throughout the 20s and peaks in middle age. So now, in terms of child and adolescent specific, this is the time of growth. Specifically, like we talk about the proliferation and the growing of the brain, but there's also the pruning, which occurs between mostly 2 to 16. And that's when you remove the connections that your brain no longer needs, and that is based on experience. You keep what you use and you lose what you don't. It's the body's way to maintain a more efficient brain function as we age and learn newer, complex information. So here's the million-dollar question. Why does it matter? And what does this have to do with social media? Adolescence is the time for risk-taking and learning. The adolescent brain seeks out new experiences and is optimizing the wiring it decides to keep. Research has shown they have greater ventral striatum activation, specifically in the nucleus accumbens, in response to reward, generally believed to peak in the late teen years and then slowly decline into adulthood. Additionally, there's also been observed greater activation when in the presence of peers than when alone. In layman's terms, when you were growing up and your mom would say, well, if your friend jumped off a bridge, would you? If you're an adolescent, yeah, maybe. Adolescent brains give larger dopamine rewards than adult brains, and that has an evolutionary function. It lets children grow into adults who are learning to live independently, and to do that, you have to take risks. And they will seek out the behaviors that get that payoff to happen again. And that system of larger rewards can help younger people learn faster from trial and error, which can be positive and negative. So another related aspect of adolescent development is mentalization. The social brain network is a collection of brain regions that are involved in understanding others and social interactions. And mentalization is a process of this social brain network, which refers to understanding the mental states of others and also regulating emotional regulation during social interactions. Another developmental process then is youth's ability to recognize, identify, and describe their feelings. So, in other words, not only learning to recognize how they feel, but also learning to recognize that other people may feel that way too. So, the reason that I have spent so much time going over all of this is that alterations in social reward processing can be associated with maladaptive outcomes, such as depression, vulnerability, social anhedonia, and social anxiety. So now connecting this into social media. So keep in mind some of the brain regions that we've been talking about. Is social media changing brain development? There was a study published in JAMA Pediatrics at the beginning of this year that suggests it may. This study was a 3-year longitudinal study So this group of subjects was 178 sixth and seventh graders from 3 public middle schools in rural North Carolina. There were 3 waves of the study. And at wave 1, participants reported their frequency of checking behaviors. So checking social media sites, Facebook, Instagram, Snapchat. So they were asked how many times per day they checked each platform, with answers grouped into 8 numerical score categories. And then the participants were split into 2 groups: low checking behavior and high or habitual checking behavior. fMRI was completed after each wave of the study. And during the fMRI scan, participants completed the social incentive delay task, which allowed researchers to measure neural responses when participants were anticipating receiving social rewards and avoiding social punishments. So basically what was done, they were given a cue indicating whether the social feedback they would get would be positive, negative, or neutral. The cue was an adolescent face with expressions. And they were instructed to respond to the cue by pressing a button as quickly as possible, and a display of social feedback then depended on the trial type and reaction time. So the participants with high checking behaviors then started to show distinct neural trajectories when anticipating social feedback. In summary, what it showed us was that habitual social media checking behaviors showed a lower neural sensitivity to social anticipation at age 12, compared with those with low checking behaviors, specifically in areas of the brain associated with social reward, think amygdala, prefrontal cortex. Comparing this to the non-habitual checkers who demonstrated initial hyperactivation in these brain areas, and then these patterns diverged. Habitual checking behaviors showed increases in activation of these regions, and those with low checking behaviors showed longitudinal decreases in activation. This decrease in neural activation may indicate a developmentally normative, decreasing sensitivity to social anticipation. Oh no, there we go. Oh no, things are happening. There we go. Normative, decreasing sensitivity to social anticipation, which actually is consistent with prior research. You want that sensitivity to decrease over time. Do you want to be more sensitive as a 12-year-old or as a 20-year-old? Hopefully less sensitive as a 20-year-old. So specifically also the decrease in the dorsolateral prefrontal cortex activation seen in non-habitual checkers may indicate that those adolescents then are better able to control impulsive or habitual behaviors. And research has shown that with constant reinforcement, dopaminergic neurons within salience-related brain regions become more responsive to social feedback. An enhanced value of rewards in the salience motivation networks may then override inhibitory control. And that brings us to a point about social media where we encounter something that is very new about social media versus social media that's been in the past, which is its constancy. All other types of social media throughout history have been intermittent and they took time. Current social media is constant feedback, and that access to constant feedback when it is engaged in does appear to be impacting brain development. And I think this study then also reveals another very valuable thing around the discussion of social media, which is it is important to be specific. It's not going to be helpful to just say social media is a problem. Is it? Is connecting with other people a problem? Is me getting to see videos of my nephew halfway across the world a problem? No, but the constancy of social media is a problem. And being specific is very important when we then start talking about potential solutions. So another problem related to the constancy of social media is one that you can recognize from basic psychology. When you have constant access with an unpredictable amount of positive, negative, or neutral feedback, you have created, in essence, a variable ratio schedule, which, as we all know, is the same kind of reinforcement you see in gambling and is by definition the most productive and also most resistant to extinction. So, the takeaway. In early adolescence, when identities and sense of self-worth are forming, brain development is especially susceptible to social pressures, peer opinions, and peer comparisons normally. Normal developmental process. Frequent social media use may be associated with distinct changes in the developing brain in the amygdala and the prefrontal cortex, and could increase sensitivity to social rewards and punishments. which means adolescents may experience heightened emotional sensitivity to the communicative and interactive nature of social media, which then could have long-term implications for psychological adjustment. However, we don't have enough information yet to know about long-term ramifications to brain health, because this is the first generation where social media has been prevalent since birth. So further research is needed examining long-term associations between social media use and brain development. Well, so now what? This has been going on, and then this year, the Surgeon General's advisory came out, and it identified increasing concerns among researchers, parents, caregivers, and health experts about the impact of social media on mental health. Ultimately, it recommends more research to fully understand the impact, because it recognizes that independent safety analyses on the impact of social media have not been conducted, and there is a lack of longitudinal studies showing long-term potential effects. However, when reviewing the available evidence, the report did cite multiple randomized controlled studies looking at young adults and adults that showed limiting social media use to 30 minutes a day, and then also removing use for a 4-week period, showed improvement in depression scores up to 35%. And for improvement in subjective happiness, life satisfaction, depression, and anxiety by 25 to 40% when removing social media altogether. Another important finding is from correlational studies. Those studies point to a higher relative concern of harm in adolescent girls and those already experiencing poor mental health, as well as for particular health outcomes like cyberbullying, related depression, body image, and disordered eating behaviors, and poor sleep quality linked to social media use. And I found this statement in particular very impactful. At this time, we don't yet have enough evidence to determine if social media is sufficiently safe for children and adolescents. At one point in the advisory, it made the statement that our children have become unknowing participants in a decades-long experiment. And ultimately, explaining that more longitudinal research is needed, help of technology companies is needed to truly understand the impact. And I think framing it that way also reveals something very important about social media when you're thinking about conversations with parents. If you had proposed this as a research study, implementing a daily, possibly addictive intervention with unknown side effects, would it have gotten past the IRB? Now, to be fair, you can make that argument about a lot of things in society, but it's something to keep in mind. So now what? We've covered history of social media, some of the neurobiology in adolescent social media use, discovered that it's turning into something of a problem. So now what? We do what we always do. We come up with a way to define it and measure it. Always the first step. So PIMU is problematic interactive media use, otherwise known as and includes internet addiction, media addiction, gaming disorder, internet gaming disorder. As you can see, there's kind of a lack of consensus of definition here. The reason for that is that World Health Organization, DSM-5, and ICD-11 don't actually identify excessive internet use as a disorder. They suggested it for consideration in the 5th edition of the DSM, but ultimately not included due to lack of longitudinal research. Internet gaming disorder is included in Section 3 of the DSM-5 TR with similar diagnostic criteria to substance-related disorders. And then ICD-11 codes have also included gaming disorder. On the subject, though, of gaming disorder, which is the only one that does have like a true diagnosis, there has been some concern that we may be confusing passionate engagement, someone enthusiastic and focused on gaming, with pathology, someone with an illness or an addiction, which, when keeping in mind problematic internet or media use, is that that's something that very frequently happens in psychiatry, right? Well, it can be tricky to differentiate between something on the edge of normal with pathology, especially considering the relative norm of social media use within the younger population. So I think of the point of this quote is that when assessing for PIMU, it should not be solely dependent on frequency. As one adolescent may use social media very frequently and not really have it negatively impact their life, but another could use social media to a much lesser extent, but it could have dire consequences for their well-being. So it's more of an emphasis on how someone is using social media and how it impacts life and functioning. But again, impacts according to who. So all that being said, some of the commonly discussed symptoms as related to problematic interactive media use. One of the most common symptoms is a fixation with screen media. Symptomatology, similar to addictive disorders. When someone is spending time online or watching TV instead of participating in other activities, playing on devices for longer than agreed upon periods of time, lying about the time spent to cover up excessive usage, using video games or internet to escape from other issues, anxiety, depression, and that leads to functional impairment, academic failure, social withdrawal, behavioral problems. So here are a few of the measures. One for child, a few for adolescents, to assess problematic interactive media use. This one is based on DSM-5 criteria for internet gaming disorder, a parent-rated questionnaire to measure media addiction for children aged 4 to 11. It has a long form of 27 items and a short form that has 9 items. The 9 Likert type items address problematic media use, with each item scored on a scale of 1, which is never, to 5 always. And then the higher the score, correlated with higher problematic social media use. Items are worded in such a way that any screen media addiction can be assessed for by the 9-item short form, which corresponds to the DSM-5 criteria for internet gaming disorder. Second one is the Bergen Social Media Addiction Scale, previously known as the Bergen Facebook Addiction Scale, developed in 2012. And this scale assesses how social media is used over the past year. So comprised of 18 items that assess 6 symptoms of addiction: salience, mood modification, withdrawal symptoms, tolerance, conflict, and relapse. If you scored a 4 or 5 on at least 4 of those statements, it could be an indicator of social media addiction. Interesting side note, scoring higher on this scale was correlated with later bedtimes and wake-up times, which we already know is associated with adolescence. So whether that means night owls are more likely to be addicted or addiction just keeps people up late, something for future research. The Social Media Disorder Scale similarly uses criteria of internet gaming disorder applied to social media use to assess symptoms of dysregulated social media use. The developers recognize 9 criteria to define disordered social media use within the adolescent population: preoccupation, tolerance, withdrawal, relapse, mood modification, external consequences, deception, displacement, and conflict. So it's made up of 27 items, 3 items for each of the 9 criteria, and then the short version is each of the 9 items that were determined to be the highest loading items from the 9 criteria. So a cutoff score for disordered use was identified as endorsement of at least 5 of the 9 criteria on the scale, and positive correlations between social media disorder symptoms on this scale and depressive mood, hyperactivity, and inattention have also been demonstrated. In summary, when you're looking at problematic interactive media use, while we do have scales to assess use and how it impacts functioning, there is no formal diagnosis. There's also no standardized therapeutic intervention for if a problem is identified. So at this point then, screening is an attempt to identify and hopefully prevent problems, and also possibly to monitor for worsening. Okay, so we've discussed ways to define and measure PIMU. Now the last section of the advisory talks about what are the next steps. It identifies that the burden of protecting children and adolescents has fallen on families. As a parent, inherently, you're expected to protect your children, and we've been expecting that parents protect their children without proper education and support. Again, from the Surgeon General's report, nearly 70% of parents say parenting is now more difficult than it was 20 years ago, with technology and social media as the top 2 cited reasons. From my personal experience, parents are overwhelmed. They feel like these kids that have grown up with social media know more than they do, and they don't know how to even address it with them. So there are a couple of lawsuits that have come out of this. In March of this year, Utah governor signed a law into place that put explicit parental permissions for anyone under 18 to use social media platforms. Those platforms will be required to block users younger than 18 from accessing between 10:30 p.m. and 6:30 a.m. unless parents modify the settings. Parents would have complete access to their child's social media posts, and they also signed a bill prohibiting social media companies from employing techniques that could cause minors to develop an addiction to the platforms. So it wouldn't allow companies to collect data or target ads. There are some concerns around how this will be implemented. Montana lawsuit, so is technically around parental controls, but wanted to share another situation there. In May of 2023, Montana signed into law the ban on TikTok to limit the Chinese government from gaining access to the personal information of Montanans. So it would fine the app if it operated in the state, or app stores if they allowed it to be downloaded. This was supposed to go into effect on January 1st of 2024, with technology that the online gambling industry already uses to block access to an app from a state where it's illegal. However, a few days later, TikTok sued the state of Montana for violating the First Amendment and other parts of the U.S. Constitution, which limit state powers, and the ban has since been blocked. So the other argument here is that we should be providing an overall safer platform for children, and the advisory proposes that this can be done by strengthening protections to ensure greater safety for children interacting with all social media platforms, developing age-appropriate health and safety standards for technology platforms, requiring a higher standard of data privacy for children, and that we should pursue policies that further limit access in ways that minimize the risk of harm to social media for all children, and supporting digital media literacy, curricula in schools, and support increased funding for research. In pursuit of that, California Age Appropriate Design Code Act requires online platforms to consider the best interest of child users and to default to privacy and safety settings that protect children's mental and physical health and well-being. Now, all of this is really good in theory, as you may imagine, as happened with the Montana lawsuit, where they put something in place and then 2 days later were immediately countersued. Happens frequently with things like this. One of the main arguments being there are some communities, online that can be incredibly supportive and even save lives. And if you're limiting access to those, that's not fair to the child either. So implications, kind of a summary of what we've talked about so far, and then some resources that I think are super useful. So potential pros, right? For as much as social media can be isolating, it can also be a way that children and adolescents who were typically at the most risk for being isolated already, the ones with crippling social anxiety, the ones who were already so bullied at school that they just withdrew into their own world, they have an avenue in which to find connection that has less immediate risks. And that is one of the main arguments against some of the media bans that we talked about. So no talk from a child and adolescent psychiatrist would be complete without some mention of Erikson. So the task of adolescents is finding your identity. Identity versus role confusion. And they are trying to find their beliefs, ideas, and values that shape and guide behaviors, and they can use social media as a way of self-expression. And studies have shown that teens report feeling less shy, more outgoing, more confident, more popular, more sympathetic, and felt better about themselves when engaging on social media platforms. And remember also that this is a time where peer influence starts to be stronger than the parental influence, and that can become then a major source of the child's self-esteem. Looking at Maslow's hierarchy, we've talked about how the constancy of social media can be negative, but what if you have a supportive community with whom you are in consistent contact? That can contribute to feelings of safety and belonging, especially when you don't have the good fortune to have access to a community like that in your physical space. Social media can be used for networking, gaining new opportunities. And honestly, sometimes social media is just fun. On a basic level, it can be entertaining to be online. We talk about avoidance strategies, but not all avoidance strategies are negative. Sometimes they serve a purpose. A way to anonymously get help. Article in Psychiatric Times in November of 2021 discussed how chatbots could potentially help fill the mental health gap in coverage for children. Chatbots, programs designed to carry on realistic text or voice-based conversations and offer advice, available 24/7. They can provide access in areas where access is limited and also provide support in a non-judgmental way. A 2017 study by researchers from the Stanford University School of Medicine and the developers of the aptly named WoBot found it was both effective in reducing depression and seen as empathetic among college students after just 2 weeks of therapy modeled after CBT. Beyond chatbots, it's also just a way to reach out for help without feeling embarrassed. One of the first adolescents I treated on the consult service told me that she had attempted suicide and the only reason she was found was that she had posted it on social media. Now, would she have been suicidal without the influence of social media? I don't know, but I do know that suicidal adolescents have existed long before social media did. And if that's one more way for someone to reach out for help, I don't think that's a bad thing. Potential cons. So this is a complicated figure. I think it serves to illustrate the point that the potential negatives are complicated and interconnected. As you can see, starting from social media can lead to almost any one of those, which can lead to any of the others, which then can also lead to further avoidance strategies. Frankly, looking at that diagram, I kind of wonder if any of us are okay. So more potential negatives in summary, just one we haven't talked about yet. FOMO, or fear of missing out. Anxiety that people have when they think people are engaging in fun activities or experiences without them. So these people spend more time on social media, monitoring their peers' activities to make sure they aren't missing out, which will temporarily decrease the anxiety, though long-term also reinforces it when they then confirm that, yes, their friends do sometimes have fun without them. Research has shown that people who spend more time on social media do experience more FOMO, though which one led to which, unclear. And then FOMO itself has been associated with depression, anxiety, and neuroticism. So, do people with mental health issues spend more time on social media, or does spending more time on social media cause people to have mental health issues? Very few studies have adopted a longitudinal design. Most of them are based on cross-sectional studies, which don't fully allow researchers to study the direction of the association. And there is consistent evidence that the types of screen use modify the association with mental health symptoms. And some research has shown that screen use can be beneficial. For example, the FDA approved a video game treatment for children 8 to 12 with ADHD in conjunction with, medication and therapy. A recent cohort study published in JAMA February of 2023 studied children aged 4 to 12 and found pre-pandemic mean total screen time increased 1.75 hours a day in the first pandemic period and 1.11 hours per day in the second pandemic period, and overall remained elevated after public health precautions were lifted. Leaves us with also then the question of what are the long-term associations of increased screen time during the COVID pandemic? Right, so talking about all of that, then we move into resources and how we can start conversations with patients. So we'll talk a little bit about digital literacy and digital access and how these can be used to channel and sometimes curb social media use. So digital literacy is the ability to use information and communication technologies to find, evaluate, create, and communicate information, requiring both cognitive and technical skills. Ultimately, this is having the user agency to be able to develop digital resilience when navigating digital resources. At its core, digital literacy has become a social justice issue through which economic, social, cultural, and civic gaps can be reduced. When we provide education around digital literacy, we are increasing access to online opportunities and giving people the skills to find trustworthy information sources. From then they can make informed decisions. Digital literacy then, when starting to have this conversation, here are some questions that it can be helpful to think about and to encourage both parents and adolescents to think about as well. Some of them seem basic, but sometimes just speaking it out loud can be helpful. Who posted the content? What does the post creator want people to do or think? Where did that information come from? When was the content updated? And why was it even posted in the first place? With these questions, you should be able to at least see when it is indicated to fact check resources, evaluate online resources, and distinguish hopefully real from fake news, among other skills. As an aside, an encouraging trend that I've noticed anecdotally in some of my adolescent patients is that since they have grown up with this technology, some of these things are kind of intuitive to them. And they've developed an almost intuitive online sense of stranger danger. Digital access, this is from Georgetown Law's website, defines digital access as the inclusive practice of removing barriers that prevent interaction with or access to websites, digital tools, and technologies. I think digital access and digital literacy are very interconnected, and the image on the side makes the point of how interconnected they are. So other sources expanded the definition to include providing access to all, especially marginalized groups. So according to the Pew Research Center in 2021, 77% of US households had high-speed broadband internet. This means roughly 1 in 4 US households do not, which is approximately 27.6 million US households. What does that number look like? That number is greater than the total number of households in 13 states combined. The least connected states are mostly clustered in the South. With common issues, those 10 least connected states face is a large rural population and a high rural poverty rate. So that last graph shows the income disparity between US adults who have that broadband internet connection at home and households making less than $30,000 per year. Approximately 57% of those households have internet access. In 2021, the US poverty level was 2,600 for a family of 4. So if we look at the households making greater than or equal to 75,000, around 92% of those households have access to the internet. So a big disparity. Here are some of the individual recommendations concerning screen time from some of our bigger organizations. ACAP recommendation is broken down by age, and you can also see they give some general then recommendations for social media use. Of interest, American Academy of Pediatrics doesn't really give a set screen time limit. They focus more on the quality of screen time. Important to consider that, the specific activities that children and teens engage in. And when it comes to household rules, there is evidence that rules focusing on content, co-viewing, and communication are associated with better well-being outcomes. When it comes to kind of curbing digital access, there's a couple of different ways. You can consider digital, so putting applications on a phone, or physical, removing the source, such as taking away the device or shutting off the Wi-Fi. Ultimately, that has to be something that is decided upon by family members. So I think one of the things to emphasize when you're having a conversation is that this is not necessarily meant to be a punishment, and that it shouldn't be implemented as such. But that being said, even if you wanted to put parental control like an app, it's not as simple as putting it in place and then thinking that your child doesn't have access to the harmful things on social media. It does take involvement of the parents with the applications as well as getting the child on board, which can be challenging. There are a lot of different types of apps out there. I didn't put any specific ones on here because there are so many, and it honestly depends on what you're specifically looking for. There are ones for different ages of kids. There are ones that are free. There are ones that are fee-based. It just depends on what you're looking for, but there are a lot of resources out there, including ones that then also have like GPS tracking. Keep moving. So this is important and bears saying again, make sure there's parental involvement, have families come up with reasonable limits, encourage them to talk to their teen about how to avoid letting social media interfere with their activities, sleep, meals, homework. Encourage a bedtime routine that avoids electronic media use and keeps cell phones and tablets out of teens' bedrooms, and encourage parents to set an example by following these rules themselves. These are a few of the basic rules that I said that, a lot of my teens honestly are starting to kind of intuitively grasp, which is personal information is personal. Protect your reputation on social networks. There was a recent survey that indicated that 90% of employers look at potential employees' social media profiles, and that 79% of job recruiters rejected candidates based on information they found online. Here are a few of the resources that I have found particularly helpful. Digital Wellness Lab from Boston Children's Hospital. Lots of different resources. There are parent resources, and then there's also the Media and Child Health Clinician Toolkit. It's free, includes screening forms, helps differentiate the impact of social media use, directs next steps of treatment. Additionally, they've gathered a lot of information around nuances of adolescent social media use and their perspectives, if you're interested. Connect Safely is a California-based nonprofit organization dedicated to educating people about online safety. Lots of resources there. Common Sense Media is an organization that's been around since 2003 provides over 40,000 reviews for you to search. Books, TV shows, provides recommended minimum age for engagement. Any controversial content, points to talk to kids about. Also has parent guides. Then this last one, healthychildren.org, I want to hone in on. It's a free resource for parents. One of the resources available for families there is the Family Media Plan. It helps families set media priorities, such as media balance, digital privacy, safety, screen time. So what happens is you add in your people and you can put in their ages. And then it takes you through all of those categories at the top and asks, what are your priorities? And then at the end, it makes an individualized plan for each person in the family. And I think one of my favorite things about this is that it so intuitively involves the parents, and it creates less of a situation of, oh, my kid needs to stop this, and more of a let's create healthy habits together. Of course, similar to what we've already mentioned, that requires that the parents are also willing to adjust their own screen time in order to set good examples, which can be its own discussion. So in conclusion, how should we as providers address social media use, both to adolescents and to adults? Honestly, just starting the conversation is the first step. As a mental health care provider, we should be asking adults and kids about social media use. Though absolutely the field needs more research, we have enough to know that it can heavily impact mental state, and so should be something we routinely assess for. When working with parents, whether in an adult clinic or child clinic, providing them education about ways they can become involved, empowering them, can be very, very useful. It's really good to encourage parents to be curious, not furious. And a shout out to our own Dr. Metz, no shame, no blame. Encourage them to ask questions about why their teen is using social media and what they like or dislike about it. What needs is it filling? If it is distracting them, from what? How much time are they spending on it, and how does it make them feel when they do and after? Parents should feel comfortable to share their own opinions about social media use. And then just, set good examples. Remind them of, in essence, what it boils down to is just normal good social interaction transfers to online as well. Don't be mean to people. You wouldn't do it here, don't do it there. So I think, in summary, one of the reasons I emphasize the history of social media so heavily at the beginning is that when discussing social media with either parents or kids, it's important to remember they're not doing something unnatural. It's what we have always done, and we've always found new ways to do it, or we wouldn't be where we are. It's absolutely true that there are unknown risks and ramifications for the current technology, and so it should be used carefully. But the ideas behind it, they're not new at all. And then also just a particular point that children and adolescents are very susceptible to both positive and negative influences. And that's it. Special thanks to Dr. Luker, who I presented this with in IACPAP. And then references.
Thank you very much. We have a comment and a question online. Anybody in the room have a comment or a question?
That was that was very comprehensive and wonderful. I am old enough to have been exposed to the television when it changed from black and white to color. And when I was growing up, people were calling it the quote unquote boob tube. Remember that? And we were warned about the effects of the television on our brains. So my question is this a parallel situation? And I don't know what the outcome was on television on the brain. I think, most of us did okay despite the television, but I wonder if there are parallels to the experience with TV.
I would say, from what I can tell, definitely yes. Unrelated, I was a history major in college. And I think part of the reason this perspective has been something I have focused on is that I just noticed a lot when I would review articles from the early 1900s, from the late 1800s, that there was always something that was going to destroy the next generation. It was different every time, but we've managed to succeed every time. And maybe this is different. It is new technology. I don't want to, dismiss the seriousness, but at the same time, whenever, this is a personal anecdote, but whenever my dad starts talking about the next generation and how concerned he is, I remind him that his mother thought that he listened to Black Sabbath and had long hair, and so he was going to hell, but he managed to be a dentist, and I think he's all right. So.
Hold on. Just want to say, Kim, that the television was a problem when it spoke back to you.
I'm not a computer scientist, but I think the big difference is the AI component, where the media is actually being manipulated and potentially like responding in real time. And that's not something that the television could do.
That is very fair. I will also say it may be more of a problem for us. Like, a lot of the things I covered are a problem for people who weren't raised with social media. But I've actually noticed that a lot of the people who are raised with it are much more intuitive in terms of like what's real and what's not. Not always. So I do think that is a realistic problem, but I also wonder about the impact of people then that are raised with AI. Like, are they able to more intuitively tell?
Sure.
So Emily, that was fantastic. I think we can't ignore that there are differences. We can't ignore that youth suicidality is going up and there are more problems than there were.
Yeah.
And also there was less access than there is now. Now, if you go on a walk in the woods and you see a parent and a child in a stroller, you see the child on the parent's phone rather than looking around at what's happening around them. So I think there are changes in terms of how things are accessible.
Yeah.
And I think the example, one of the websites, the American Academy of Pediatrics Healthy Minds.
Yeah.
The family media plan. I think what's really, really great about this one is that it doesn't tell you what is the limit for media. It tells you, well, these are all of the other things that your family wants and needs and should be doing and is healthy for them and makes them happy. And how are you going to find the time to do all of those things if you're spending this number of hours? So it's more about what we're missing and what children are missing from a very early age, rather than sitting in front of the TV for hours at a time is really, really bad for your brain, which is what my dad would tell me to.
Yeah. That's a good point.
We'll have to have this be the last.
Well, one question I had was, are there any studies or anyone looking at educating adults on digital literacy and things like that? Because things that even I, who consider myself pretty digitally savvy, don't understand intuitively, my kids know like this. And I use the corollary of computers for those of us that grew up, breaking computers and learning how to rebuild them. It's very easy for us to get around something, whereas the generation prior to us may not understand that. And I'm wondering if there's a corollary here, looking back on the history of things and where AI is taking us next. But are there studies looking at, educating adults and parents specifically on digital literacy?
Not that I've come across. There's some some of these resources are for parents, but unclear really how in depth they go, and not so much a curriculum around like digital literacy and how you can really teach it. So no, not that I found.
Thank you very much. It was very interesting.
Thank you.